Today we're diving into a topic that might surprise you, the potential interactions between medications and a common food, eggs. Eggs are a breakfast staple for many, packed with protein and nutrients. But what most people don't realize is that this beloved breakfast food can interfere with the effectiveness of some common medications. So let's get started. Our first medication group is cholesterol-lowering medications, specifically statins. Statins are incredibly common, prescribed to millions to help lower cholesterol and reduce heart disease risk. You might be thinking, eggs have cholesterol, so how could they be a problem? Well, here's the thing. While dietary cholesterol isn't as directly linked to blood cholesterol, it can still play a role. Janet, a 65-year-old woman, was prescribed a statin called Lipitor. Janet loves her morning eggs and continued this habit after starting her medication. She was unaware that the cholesterol in eggs could reduce the effectiveness of her statin. A study found that dietary cholesterol from eggs might interfere with statins. If you're on statins and enjoy eggs, consider reducing your intake or exploring alternative proteins. It's crucial to communicate with your doctor or a registered dietitian. Moving on to our next category, let's talk about GERD medications, specifically proton pump inhibitors or PPIs. GERD, or gastroesophageal reflux disease, is a common condition that causes heartburn and acid reflux. PPIs are very effective at reducing stomach acid production and alleviating those uncomfortable symptoms. However, certain foods can actually worsen GERD symptoms even when you're taking medication. Alice, a 70-year-old woman from Manchester, was prescribed omeprazole, a commonly prescribed PPI. She noticed that her GERD symptoms weren't fully controlled and was still experiencing frequent heartburn. Research published in the Digestive Diseases and Sciences journal has shown that high-fat foods like fried eggs can actually relax the muscle that keeps stomach acid down. Opting for boiled, poached, or scrambled eggs prepared with minimal oil or butter can be a much gentler option for your stomach. Next up, let's discuss blood pressure medications, specifically ACE inhibitors. These medications are essential for millions of people in managing their blood pressure and reducing the risk of serious complications like heart attack and stroke. Now, you might be wondering how eggs could possibly have an impact on blood pressure medications. Well, it all comes down to a mineral called potassium. Potassium plays a vital role in regulating blood pressure, and ACE inhibitors can sometimes cause potassium levels to rise in some individuals. Margaret, a 68-year-old woman from Birmingham, was prescribed lisinopril, a common ACE inhibitor. Margaret has always been a fan of eggs, incorporating them into her diet almost daily. The European Heart Journal published research highlighting that the potassium in eggs, when combined with the potassium-raising effects of ACE inhibitors, could potentially lead to hyperkalemia. Talk to your doctor about your diet and ask if you need to limit your potassium intake. Let's move on to another crucial medication category, diabetes medication, specifically metformin. Metformin is a widely prescribed medication for type 2 diabetes, helping to manage blood sugar levels and improve insulin sensitivity. John, a 70-year-old man from California, has been managing his type 2 diabetes with metformin for several years. Research suggests that consuming eggs might impact insulin sensitivity in individuals taking metformin. The key is to be mindful of portion sizes and monitor your blood sugar levels closely. Next up, we're diving into thyroid medications, specifically Synthroid, also known as levothyroxine. This medication is a lifeline for millions of people with hypothyroidism, a condition where the thyroid gland doesn't produce enough thyroid hormone. Proper thyroid hormone levels are crucial for regulating metabolism, energy levels, and overall well-being. Evelyn, a 66-year-old woman from London, has been taking Synthroid for hypothyroidism for nearly a decade. Recently, she's noticed a change in her energy levels, feeling unusually fatigued and sluggish. The Journal of Clinical Endocrinology and Metabolism published research indicating that consuming calcium-rich foods or beverages too close to the time you take your thyroid medication can hinder its absorption. If you're on thyroid medications like Synthroid and enjoy eggs, the key is to separate the two. Aim to consume eggs a few hours before or after taking your medication to avoid any potential interference with absorption. Let's talk about antibiotics, specifically a type called tetracycline antibiotics, with doxycycline being a common example. Antibiotics are essential for fighting bacterial infections, and are often prescribed for a wide range of conditions, from respiratory infections to skin infections. Frank, a 75-year-old man from Vancouver, was recently prescribed doxycycline for a respiratory infection. He noticed that his condition wasn't improving as quickly as he expected, and his symptoms lingered. According to the Journal of Antimicrobial Chemotherapy, the calcium in dairy products, including eggs, can bind with doxycycline in the digestive tract, forming a complex that the body struggles to absorb. If you're prescribed tetracycline antibiotics like doxycycline, it's crucial to avoid consuming calcium-rich foods like eggs around the same time you take your medication. Talk to your doctor or pharmacist about the best timing for taking your medication and consuming dairy products or calcium-fortified foods and beverages. This will ensure the medication works effectively. Next, let's discuss blood thinners, specifically warfarin, a medication prescribed to prevent blood clots and reduce the risk of stroke or heart attack in individuals at risk. Blood thinners like warfarin work by interfering with vitamin K's role in blood clotting. Maintaining a consistent intake of vitamin K is crucial for individuals on warfarin to ensure the medication works effectively and safely. Robert, a 72-year-old man from Toronto, was prescribed warfarin after experiencing a heart attack. Unfortunately, Robert started experiencing unusual bruising and minor bleeding, which are signs that his blood was becoming too thin. Research published in the Journal of Thrombosis and Hemostasis indicated that consuming large amounts of vitamin K2, especially from foods like egg yolks, could potentially interfere with the effectiveness of warfarin. If you're on blood thinners like warfarin, it's crucial to be mindful of your vitamin K intake, including from foods like eggs. Talk to your doctor about your diet to ensure your medication works effectively. Now let's talk about immunosuppressant medications, specifically cyclosporin. These medications are crucial for individuals who have undergone organ transplants as they help suppress the immune system and prevent organ rejection. Helen, a 74-year-old woman from New York, has been diligently taking cyclosporin since undergoing a kidney transplant several years ago. The American Journal of Transplantation published research highlighting that consuming foods high in cholesterol while on certain immunosuppressants might lead to increased drug levels in the blood. If you're on immunosuppressants like cyclosporin, it's crucial to have open communication with your doctor and a registered dietitian. They can help you create a personalized meal plan that takes your medication and individual health needs into account. This ensures you're getting the nutrients you need without compromising your health. Let's move on to diuretics, specifically hydrochlorothiazide, a medication commonly prescribed to treat high blood pressure and fluid retention. Diuretics work by helping the body get rid of excess water and salt through urine. Paul, a 71-year-old man from Glasgow, was prescribed hydrochlorothiazide to manage his high blood pressure. Paul enjoyed eggs as part of his diet but started experiencing muscle cramps and weakness, which are common symptoms of low potassium. While eggs do contain potassium, they might not be sufficient to offset the potassium loss induced by certain diuretics. If you're on diuretics like hydrochlorothiazide, it's crucial to be mindful of your potassium intake. Talk to your doctor about whether you need to make any dietary adjustments or take potassium supplements. Finally, let's talk about anti-seizure medications, specifically phenytoin. These medications are crucial for individuals with epilepsy in managing seizures and improving their quality of life. Grace, a 73-year-old woman from Boston, has been managing her epilepsy with phenytoin for many years. Recently, she's noticed an increase in the frequency of her seizures, despite not making any changes to her medication regimen. Research published in the journal Epilepsia found that consuming high-protein foods like eggs around the same time as taking phenytoin could interfere with the medication's absorption. If you're on anti-seizure medications like phenytoin, it's essential to talk to your doctor or pharmacist about the best timing for taking your medication and consuming protein-rich foods like eggs. This will help maintain stable blood levels of the medication, ensuring optimal seizure control. So there you have it, 10 types of medications that might require you to be mindful of your egg consumption. Always consult with your doctor or a qualified healthcare professional before making any changes to your diet or medication regimen. Don't forget to subscribe to my channel for more informative videos about health, nutrition, and well-being.